strongly defending his government's response to the COVID-19 epidemic since assuming office on August 2nd, 2020, Minister of Health Dr. Frank Anthony announced that during the month of March, in excess of 200,000 more doses of COVID-19 vaccines will arrive in Ghana.
Tomorrow morning, we'll be getting 20,000 more vaccines that are coming in, and we'll be using that to immunize our workers. And on the 8th of March, International Women's Day, we'll be getting 80,000 more vaccines for the people of this country. And later in the month, we'll be getting another 100,000 through the COVAX mechanism.
Minister Anthony divulged that frontline healthcare workers who were inoculated last month with the AstraZeneca vaccine doses that were donated by the government of Barbados will receive their booster doses from the new tranche. Speaking during the daily COVID-19 update on Monday, he noted that with the supplemental doses, the vaccination drive will go beyond frontline healthcare workers to cater for the elderly and persons with comorbidities.
We have identified the persons who are older, and to help us to do that identification, we have been working with the Ministry of Social Services, where we're going to use the database for persons receiving their old age pension. So at least we'll have a sense of who those persons are, where they're living, and so forth. And we will then be able to use that to reach those persons.
The ministry will acquire lists of persons accessing the various health centers, district hospitals, and other health facilities for treatment of underlying health conditions to initiate the process of having them vaccinated.
Strategies, bilateral strategies to get in some more vaccines. So as we get them, we can expand the recipients of these vaccines. And of course, we are going to do this not just in Georgetown, but the 35 teams that we've trained are going to be in all the regions of Guyana.
Even with the allocation of more than 200,000 doses, only roughly 100,000 Guyanese will be able to receive the mandatory 2 doses of the vaccines. This, according to Dr. Anthony, still leaves the country far away from the achievement of a herd immunity at any time soon. Herd immunity requires 70 to 80% of the population being immunized against the virus, which causes COVID-19. With a population of less than 1 million and nearing 800,000, this translates to more than 600,000 persons receiving the potentially life-saving jabs to attain herd immunity. This figure excludes children who will not be vaccinated in the near future. Meanwhile, on the issue of a breach of the mandated gathering capacity at a recent drag racing event of the Guyana Motor Racing and Sports Club held on Sunday at South Dakota Circuit, the National COVID-19 Task Force has suspended all activities of the GMRNSC until further notice. Minister Anthony explained the process for approval of such events.
A lot of time when the task force would agree to events, we normally would meet with the people who are hosting the event, and we explain to them what are the conditions that they must meet to host this event. Once they agreed and they show us how they're going to put those measures in place, then we will allow them to go ahead with the event. If, however, we sign off and allow the event to go ahead and then there are breaches, then obviously we would not be able to continue working with that organization.
Temika Rodney reporting for the HGB Nightly News.